Americans are being warned to prepare for the spread of the coronavirus in the U.S. after a surge in cases across the globe. It's a change in tone from the U.S. Centers for Disease Control and Prevention, which had previously focused on quarantining people arriving from China.
The immediate risk to the general American public remains low. But as we have warned, that has the potential to change quickly. There is now community transmission in a number of countries, including outside of Asia. That's deeply concerning, and community spread in other countries will make successful containment at our borders harder and harder.
Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected and how many of those will develop severe or more complicated disease.
San Francisco has already declared a local emergency, even though there have been no confirmed cases in the city. Lawmakers are being urged by health authorities to approve $2.5 billion to fund the fight against the virus.
Nick Harper joins us from Washington, D.C. for more on this. So, Nick, what measures are actually in place to deal with a possible outbreak within the United States?
Well, Steve, for some time we've had the airport screenings in place. Passengers arriving in the US are having their temperatures checked. That's happening at 11 airports. But there are now 53 confirmed cases across the United States. And we seem to be entering a phase where the CDC and other health officials are essentially saying it's time to step things up. We need to be as prepared as possible. Those warnings from the CDC on Tuesday essentially saying it's not a case of if, it's a case of when, suggesting they may even get to the point where they need to start shutting schools across the United States to try and reduce or at least prevent the spread of the virus. So at this stage, it's a case of being prepared, and that's certainly the situation in San Francisco. They don't have any confirmed cases there yet, but they have declared a state of emergency. That essentially means they're able to release more funding, they're able to put more doctors and nurses on call. It puts them in a better position if things go badly wrong in that city. And also the CDC is saying that the search for the vaccine is, it would seem, speeding up. They're suggesting that human trials could start as early as 6 weeks' time. So a number of measures being put in place. It's that situation of being prepared rather than trying to really say that now is the time for all-out panic across the US.
Well, Nick, tell us about this backlash over the Trump administration's response to the crisis.
That's right. Well, that seems to come largely down to the issue of funding. The Trump administration has asked Congress to release $2.5 billion. Now, $1.25 billion of that is absolutely brand new funding. The rest of it is requisitioned from other older funds. For example, $500 million coming from an old Ebola fund. However, the Democrats are saying that's simply not enough. The House Speaker, Nancy Pelosi, has called that amount not just long overdue, but also completely inadequate to deal with the extent of the emergency. They're saying that more funding needs to be released. But there's also a problem with the messaging at the moment, which seems to be very mixed. Essentially, the Trump administration versus health officials. Donald Trump speaking to reporters when he was in India on Tuesday, essentially trying to calm things down. He said that the US was in very good shape, that it was a situation that was very well under control. A few hours after that, the acting Secretary of Homeland Security, Chad Wolf, again saying the threat right now remains low. But the CDC at the same time was suggesting that things could get much worse, that disruptions to daily life, they said, in the US would become severe. So there is that concern, that spat that has developed over the funding, but also how the Trump administration is currently portraying the situation in the country.
All right, thanks. Nick Harper in Washington, D.C.